Welcome to Biz Wire. I'm Joseph Nordstrom in Beijing. The number of confirmed H7N9 bird flu cases in China continues to rise, with 77 confirmed cases and 14 deaths reported. The new strain of the virus is still evolving, making it harder for scientists to predict how dangerous it might become. Influenza experts say that the H7N9 strain is probably still swapping genes with other strains until random selection makes it fitter. If the strain does mutate and become easier to transmit, the world could then be facing the threat of a deadly flu pandemic, though there is still hope that it may fail and just fizzle out. The instability of the virus also raises questions about whether H7N9 might become resistant to antiviral drugs such as Roche's Tamiflu, a possibility already suggested by analysis of genetic data available on the strain so far. Writing in the New England Journal of Medicine last week, researchers who conducted a detailed analysis of the strain's origin said it seemed that so far the reassortment of genes to make H7N9 had taken place in birds rather than in humans or in other mammals, which they say is a somewhat reassuring sign. Wendy Barclay, a flu expert at Imperial College London, said this may continue and could mean it is some time before the strain finds a form in which it can spread swiftly and efficiently in bird populations. While experts take some comfort that so far the virus is not passing from person to person, a factor that would dramatically increase its pandemic potential, they are worried that they still don't know how the 77 human infections have occurred. The world's worst known pandemic, the Spanish flu of 1918 that killed more than 50 million people, was also a bird flu that had picked up gene mutations that enabled it to spread efficiently in humans. David Heyman, a flu expert, said influenza viruses are very unstable and mutations are a random event, so nobody can predict when it will happen. Chinese health science companies and research institutions have been racing to find answers as to why the current outbreak is occurring and how to contain it. Chinese officials have started researching the development of vaccines for H7N9, but it could take up to 6 to 8 months before a product can be brought to the market. To satisfy demand in the present situation, China's Food and Drug Administration last Friday said it expedited its approval of the BioCryst Pharmaceuticals anti-influenza drug Peramivir, which is not a vaccine, but it does help to slow the spread. China is actually given much less credit than it deserves as an innovator in biotechnology, which is being promoted by the government as one of 7 priority industries for the country. For example, BGI, the world's largest rapid gene sequencing center in Shenzhen, is on a quest to discover the genes governing human intelligence. Separately, China's SciBiono Gene Tech introduced the world's first gene therapy drug, Gendosine, for head and neck cancer, attracting foreign and Chinese patients eager for treatment. This month, Beijing-based Sinovac Biotech announced a successful late-stage trial of a hand, foot, and mouth disease vaccine that may soon add to the company's roster of vaccines for hepatitis, which is prevalent among Chinese. Besides Chinese companies receiving support from the state, private multinationals like what they're seeing in China and have been steadily investing in the sector. Eli Lilly recently announced a $100 million investment in the country, and French drug maker Sanofi said they plan to open 4 manufacturing plants in China, up from its current 6, and expand its production of pharmaceuticals, vaccines, and consumer health care and animal care products. Meanwhile, global pharmaceutical giant Merck announced its intentions to build a $1.5 billion research and development center in Beijing, beating Novartis' $1.2 billion center in and around Shanghai. China's aging population is driving the government to find cost-effective healthcare solutions such as new drugs and vaccines. At the end of 2009, China had an estimated 180 million people over the age of 60, and that number is expected to grow to 400 million, or nearly a quarter of the population by 2050. Drug makers have in recent years looked at China as a market with high growth potential and one that could help offset sluggish sales from patent expirations. Growing at about 22% annually over the last 5 years, China's pharmaceutical market is second in size to the U.S. and according to IMS Health is expected to become the world's biggest by 2020. Once predominantly focused on producing generics and performing contract research for Western companies, the industry is developing at a rapid clip in China. According to China Bio, a Shanghai-based consulting firm, China's central, regional, and local governments are investing about $40 billion a year into the sector, which in turn has helped to attract some $10 billion annually over the last 3 years from venture capital, corporate investments, mergers and acquisitions, and initial public offerings. Spurred by generous government investment and the return of thousands of China-born, Western-trained researchers and managers, more Chinese companies are now engaging in new drug discovery, and foreign pharmaceutical companies, like the ones mentioned previously, are clamoring to set up partnerships with them. There has been more than just state subsidies like low-interest loans and preferential land use rights. In 2008, the central government launched the 1,000 Talents program, which has brought back more than 2,000 high-level Chinese-born science and technology academics and professionals. In fact, a 2010 Monitor Group study says that some 80,000 life science professionals have gone back to China. Western-trained scientists and global-spanning partnerships can help accelerate China's drug development, but some say China is still far behind when it comes to blockbuster drug discovery. Critics point out that few of China's universities and research institutions teach or practice the risk-taking mindset that has fueled U.S. innovation in life sciences, though other experts say China is starting to establish a few such institutions. Stephen Samut, a lecturer at Wharton and biotech venture capitalist, says China may be 5 to 10 years away from seeing something that begins to duplicate what the U.S. is doing in biotechnology. Samut says that right now China should focus on building its drug regulatory system, intellectual property protections, and a healthcare system that can encourage and absorb new technologies. With the spread of bird flu, China's investments in its life sciences industry will be further put under the microscope and will give the burgeoning sector a chance to show what it can do and make a name for itself. You're watching Biz Wire on the Blue Ocean Network. Let's turn now for a quick look at a few stories that are buzzing in the market right now.